Welcome, my friends and sisters in healthcare. You are listening to the Bedside Manner podcast. This show was developed for female healthcare professionals by female healthcare professionals. So come on in, get cozy, and get ready to laugh, cry, and learn as you are introduced to incredible women from all across the nation and their one-of-a-kind stories, passions, and tangible tips to empower your life and career.
You are listening to the Bedside Manner podcast with your show host, critical care registered nurse, DNP student, nursepreneur, and lover of all the science, self-care, wellness, healthcare, and Harry Potter things, Danny Ernest.
You are listening to episode number 2. Now let's get the show started. Welcome everyone to the Bedside Manner podcast. My name is Danny Ernest and I'll be your host. This is a female healthcare podcast for all female healthcare professionals. And today I have the wonderful honor of interviewing Sarah Merritt. So Sarah, without further ado, I'm going to have you go ahead and start. So just kind of tell us about why you started, how you got started, and what got you interested in doing healthcare.
Well, let me see where to start here. We had kids really early in our life, so school wasn't really a priority for me at the time. So when I was actually looking to going back to school, I was like 27 years old. And I didn't really have a clue what I wanted to do. I knew I wanted something that was, stable in more stable than the healthcare system. I would hope
Exactly.
to think. You're always going to need somebody there. So
Always
I was actually
people.
Yes, I was actually talking to my aunt, Sandy, about career paths. And I was thinking of doing maybe like a rad tech or something. Nursing was never really an interest of mine. I know you guys work hard and you're rock stars, but it just wasn't appealing to me. So I told her that I was going to sign up for the rad tech program and that there was a waiting list. And she said, well, have you looked into respiratory therapy? And I said, huh?
Like, what?
Never heard.
Respiratory therapy, right?
Right. And, she's a firefighter, so I'm sure she has come into she's a medical professional herself, so she knows.
Oh, yeah. She definitely knows.
A little bit. She knows a little bit. So, yeah, so that kind of perked my ears up a little bit. My whole thing, it wasn't like, I looked into it a little bit and it didn't sound like super appealing to me, but I was going to be on a waiting list for a couple of years, probably for the rad tech program. It was crazy.
Oh, wow.
Yeah. So I was like, oh, what the heck? I'm not trying to wait forever to go to school. I need to get my feet in and get going on something. So
yeah,
that's
absolutely
where it happened. And there was no waiting list. So that made it more appealing.
Excellent. So where did you go to school then?
I went to school at Lake Superior College.
Okay, perfect. Yeah. So that's exactly where I went for nursing as well. So yay. So we're 2 LSC alumni. Excellent. Wonderful. So the hot and feverish topic of 2020 and of this episode is, of course, COVID-19. This episode is not only to talk about respiratory therapy and their role, but to really bring awareness and acknowledgement of the rest of the healthcare team, because believe me, there's more than just nurses and physicians that can be found running around inside of the hospital. And it really and truly takes an entire team of people with different backgrounds and specialties and experiences to care for these COVID-19 patients and just in general. So here is a shout out to all healthcare professionals doing their thing during this time. Something else that the general population doesn't know is the value of respiratory therapists and how crucial they really are to the fight against COVID-19 and every other day in the healthcare world. So cheers to all respiratory therapists around the nation. So how do you think COVID-19 has impacted the recognition of respiratory therapists?
Since COVID-19, obviously respiratory therapy has been recognized more. Like before then, I feel like if I told someone that I was an RT, they were like, what do you do? I'm like,
what? Yeah.
So
what does a respiratory therapist do, Sarah?
So if someone comes in short of breath, whether it be an asthma attack or COPD exacerbation, or just someone just having a hard time breathing in general, they'll come into the ER. We'll come down and assess them. We'll give them breathing treatments. We have machines to put on them if they need extra assistance. Also, So it's little things like just administering nebulizer treatments, inhalers, giving instruction, education on medication, and then it can go to like CPAP and BiPAP use, and then getting into obviously ventilators and just management of the ventilators. But amongst all that, we have all the crazy, emergencies that we're responsible for. We got to run to any kind of code blues or anything like that, or any kind of rapid responses. We show up as part of a team to assess and give assistance. So,
have you seen an influx of COVID-19 patients, and how has your role been impacted since it's a respiratory virus, or it's a virus that affects the respiratory system?
So initially when COVID-19 hit, obviously there was so much unknown that we didn't even have any kind of data to go off of to see what really helped and what we could do. So it was a lot of trial and error and just listening and investigating and other studies that were being done to figure out what would work. We really veered away from CPAP and BiPAP use, and also nebulizers, because they weren't working.
Wow.
Yeah. So that was in the beginning.
Right.
I think that was more of so much is unknown, and we want to keep risk, of exposure at a minimal. So we're going to do what we can as necessary. And that's kind of it. So now that we've progressed, we've been dealing with this for months now. We are giving nebulizers, but we really only give them to patients that have a pulmonary history of some sort, or they take nebulizers and stuff at home. Otherwise, you're aerosolizing and you're putting people at risk if it's not really helping the patient. They're not any kind of relief. It's doing more harm than good.
Excellent. Yeah, you're so right. This has been a new virus that has been a challenge to our entire healthcare world. And it's really been intriguing to see the difference in interventions and treatments as the CDC and the healthcare professionals are learning more and more about this coronavirus every day. So have you seen an increase in recognition for respiratory therapists in your own facility? And how's your team doing? How's the morale?
I feel like we've all just band together. I mean, there's a few like nurses that I know. I've been at my place for 10 years now, so I have quite a relationship with a lot of nurses and staff there. But they're always like, "Oh man, how are you doing? How's it going? You guys doing okay?" I mean, I feel like there's a little extra love shown, but
We just excellent.
Oh.
So what have you found most helpful to boost your team's morale during this time?
Well, obviously, as I'm sure people know that I've worked at multiple facilities, it's different at every single hospital, how things are run and how things are done. And at our hospital, it is, I think, pretty much unlike any other hospital around in the area, as far as our nurses are, like our ICU and critical care nurses are pretty, and I mean, they've adapted and taken on part of responsibility of respiratory therapists, especially during this time. So if nurses are in the patient's room, the COVID patient's rooms, and we need them to do something real quick, like they have no problem doing that. So just showing the camaraderie. We have great nurses that assist us in the ICU. I love them. And as far as other places that I've worked or done my clinicals and stuff, like respiratory handles 100% of the airway all the time. It's a little different at our hospital. Like our nurses in the ICU will actually extubate patients.
Oh, wow.
So it is a different scenery, and there's a lot of trust and relationships built with that goes along with that. So they are a huge part. I mean, if I walk by the room and I need like a water bag changed, they'll change the water bag. If I need a blood gas drawn off of a line, they'll draw me a line and a gas and hand it to me through the door, so I don't have to come in. I mean, we're still doing minimal exposure, so it does help a lot that our nurses are fabulous.
Yeah, during minimum exposure, it's so important to be able to work as a team and help each other out. And it's really crucial also to facilitate trust and those really supportive professional relationships during this time. But yeah, in Duluth, at my facility, the scopes of RTs and RNs are different, but this is really true across the entire nation, with the varying degrees and scopes of respiratory interventions and responsibilities. But in my role as a bedside ICU nurse, we can titrate our FiO2 and follow the fast-track extubation protocol for open heart surgery patients, but we aren't able to physically extubate our patients.
Right, because I went to school. I did my clinicals in Duluth. I did my clinicals at St. Luke's and now Essentia. But yeah, it was really weird to walk into my job and know that I'm not going to be extubating these patients, more than likely. Yeah. So I was like, oh, okay. You adapt to it. Like I said, I've been there 10 years. And if I know that someone's being extubated, I try to be present if I'm in the ICU, just so I can assist and get the machinery out and make sure everything's good with the patient. But we rely on our nurses a lot. I don't know. It's different. I mean, we have, nurses on the floors as well. A part of their requirement is to be able to NT-suction patients.
Okay.
Which, I mean, I haven't heard anywhere else either. I mean, anywhere known, they've always called respiratory to do that. So, but as part of, nursing protocol that they need to be able to, and like in case of an emergency, there's only 2 or 3 of us on overnight. So it's a pretty big hospital. And if we can't get there and someone's having trouble, you have to be able to know, what to do. Obviously, if you need help or you're nervous about it, you're going to call, but it's a big partnership. Yeah.
Yes, the partnership is such a big part of patient care during this season of COVID-19 and every day. And as far as the scopes of practice go, anti-suctioning, our RNs are expected to do this as well. And it's really interesting because I feel there's often confusion about who is really responsible for anti-suctioning. And it's really common from just talking to many RTs nationwide. And you're entirely right. Communication in healthcare is so important to organize and deliver the care these patients need at this time. So switching gears a little bit. So when did you see the influx of COVID-19 patients? And based on what's going on now, did your team expect more or less?
It got big. Around March, I think, was when it was it March? I can't remember the time it's been. It feels like we've passed 2 years in the last 6 months.
Yeah, absolutely.
So it's hard. I don't know when it started, but when it started, my hospital that I work at is pretty much 90% geriatric population.
Okay.
So we don't see a lot of kids at all, or younger adults even. We're amongst 4 huge hospitals within a 20-mile radius. So I work in St. Louis Park, and it's a very geriatric population there. So we see a lot of people from nursing homes and stuff. So obviously that was a huge population hit by COVID.
Yeah.
We would have times where assisted livings or group homes or part of nursing homes would be emptied out into our hospital because there was positives, and obviously the newness of COVID, everybody was so scared and get them out, quarantine them and stuff. So I feel like that, I'm trying to think back to what you were saying, all your points you're trying to.
Sorry, I just have so many questions for you here. Well, I'll just transition into the next one here instead. So how can we improve partnerships and patient care outcomes within the healthcare team during this time, from RNs to RTs or RTs to RNs or to physicians? What are your thoughts on that?
I think communication is number one. And if you don't have that, you're not going to be successful. Just keeping in touch. If you know that you have COVID patients, you need to kind of be in the know of what's going on with them. Even if they're not on my radar, on my work list, I still know if they're having high O2 demands, just kind of keep my eye out and kind of check in with them. I also we have what's called flying squad nurses who kind of are they run all over the hospital and put out little fires, help where they can. And then they're part of the rapid response team as well. So I keep in touch with them. We have a really good relationship with them. Just communication and trying. Obviously you guys have a lot on your plate as well. So, just trying to do as much as you can before, don't just be like, oh, they're wheezing, I'm going to call a respiratory, that kind of thing.
Well,
if there's measures that can be taken, I'm being blunt about it. That's what happens.
Please do. I am all about real and being authentic, because that actually leads me into my next question here.
So what do you wish we were taught as new nurses, or what do you wish we knew about respiratory interventions as new grad registered nurses?
Well, a few things that we get called for a lot is, patient sounds wet and wheezy, come give a nib. That's kind of our go-to for a lot of people. And I think, when I get that call, I look the patient up and I'm looking at their eyes and nose. I really shouldn't have to do that. I feel maybe not, I shouldn't have to, but I look at their pulmonary history, and I look to, for the reason they're here, I look at their x-ray results from that day or the most recent one. And I'm trying to put a picture together before I go there. And when I go there and they're, drowning, or they're super crackly and wheezy, upper airway wheezes and stuff. And clearly a nebulizer won't help, but that's clearly to me, not to the nurses.
Yeah.
So, I mean, just taking into account their history, and, is someone that doesn't have a respiratory history at all and is just like fluid overloaded for whatever reason. Like, we get a lot of them calls on the cardiac unit. Obviously, a neb's not going to necessarily help with that. The medication can't really even get down to where it needs to go because you're fluid. So, but like I said,
please, Lasix, yeah.
Yeah.
Get the fluid off of patient.
I'll bring a BiPAP, but a neb is not warranted here. So, like, that's one little thing to touch on. We get a lot of calls like, oh, patient went up to the bathroom and they're short of breath, come give a neb. And it's like, no, that's not. You need to let them rest a few minutes and see if they can catch their breath, because usually it's just an exertion thing. And, hold on, just hold on. Call me if you
oxygen plugged in, like,
right.
Or is a nasal cannula hanging out there, like
on their forehead, It's nothing. It's just little things. And I'm totally for it. Like, if I come to assess a patient and I really don't think a neb's warranted, I'll grab the nurse and I'll talk to her about it. And I will give my input, and you should probably call the doctor, or maybe this should have been a rapid response, and just to get another, get some more nurses and a doctor in so you can get the meds you need ASAP. And I like to be part of the team. I'm a total team player, and I like that part of it.
Well, cheers to that. We all appreciate a good team player.
So when you meet a new respiratory therapist at the hospital, so what are your must-teach tips to these new grad respiratory therapists?
So I work night shifts, 12-hour night shifts. That's what I do. So I do not see a lot of the brand new therapists getting their orientation or anything like that. So, sorry.
No, you're okay.
Sidetracked here. We will see them eventually in their training when they start to go to evenings and stuff, and just to see the different areas of care during different shifts. But my biggest thing is we just had a meeting with our manager, and we were talking about this, and it's like, we need to instill, like, going the extra mile and not just doing what is just expected of you. It's going above and beyond and talking to nurses and being more included. It's, I don't look at this as a paycheck. I mean, I do care for people, and I know people need help, and I like to help them. So it's bigger to me than just a paycheck.
Oh, yeah.
So I try to do that in new therapists. It's like, don't just look at this as points, and don't just give these people a number. I like to get involved and talk to them and learn about them. And it's more of a personal thing.
So for any future respiratory therapists, or for any undecided healthcare professionals who would like to go into respiratory therapy, do you have a list of tips or a list of pros for becoming a respiratory therapist?
Pro list.
Yes, pros list. Like,
you get
all
to work around
things.
Yep, you get to work around awesome people, nurses, doctors, everybody on the team is great. One pro about being a respiratory therapist is that we deal with from here. I don't know if you can see, but from here up, if you catch my drift, nothing below the. So that part, from down here up, and not below the waist. So that part is good. Now, don't get me wrong. I've helped, I help turn people and grab urinals and do stuff like that all the time. So I do see parts of it, but not the dirty work.
Yeah.
So that part. Another bonus is, as a nurse, you have, like, I don't know, depending where you're working, you have 2 to 6 patients for your whole 12 hours. And it's way different for respiratory. Like, we'll have a list of like 10 to 12 people, and we're only spending 15 minutes with each one. So we kind of move all over the hospital. We're not stuck with the same patients like for a long period of time. And I hate to say stuck with, but you know what I mean?
sometimes being stuck with the same patients can be very draining. So being able to kind of go see someone else is pretty nice.
Right. So that part is good. Just, having more flexibility. There's no set lunch breaks and there isn't for nurses either, I'm sure. I mean, everybody is buzzing around and you kind of do what you can when you can. So it's kind of fast paced. I think like daily when I'm working, I get between 15 and 20,000 steps. No joke. I mean, we walk. Yeah. Also like just being involved in like the code blues and stuff like that. That's still, I've been in RT for 10 years and that still gets my blood pumping. That's like where I thrive. I love to be in the middle of all that. So
absolutely.
Every day it isn't the same every day. It's something different every day. You never know what to expect. So that part is, I like it. I like that part about it.
Yeah, I'm sure it's an absolute rush to intubate the patients during those code situations. And, you guys, the RTs, really get to solely focus on the airway being right at the head of the bed. And, we obviously need an airway so our brain, heart, and other important organs can get enough oxygen to survive those kind of patient situations. So
it is a nice feeling, yes. And it's, you see some scary things, you see some bad things, but I think you're going to see that whether you're a nurse. I mean, you could see it being an orderly in the hospital. So you need to be prepared for that kind of stuff. But
yeah, absolutely.
I mean, there are bad days, you know.
So as a respiratory therapist, what do you do personally to handle the traumatic situations and all the difficult code situations that you are a part of?
Well, it's good to have good coworkers that you can kind of vent and just decompress after things happen. We do have like debriefings in our hospital where we all kind of get together and talk about it just to go through step by step, see if anything could have been different and just kind of get your feelings out there. So that's helpful. But I leave my home at home when I'm at work and I leave my work at work when I'm at home, and I have no problem with that.
I think we all really need to learn how to actually keep work at work. I know I've only been an ICU nurse for just over 3.5 years, and I'm finally just starting to grasp this concept of keeping work at work.
I drive 30 minutes to work and back. So after my 12-hour shift or 12 and a half hours of being there, I have 30 minutes of nice, quiet, reflecting time in the car to kind of unwind and just let things play through my head, make sure all my stuff, I'm a little OCD with things. So I rack my brain just to make sure I didn't forget anything. And I don't know. I'm able to I pass it on and report, and I just place patients in the next RT's hands and hope that they're going to continue on getting the same great care that I would give.
So do you have any words of wisdom or words of encouragement for any respiratory therapist who's just starting or who's just graduating?
I think it's a great field to get into. I don't know. It's kind of, I think it's going to be an undying profession as well. I mean, I know some places nurses do take over more roles from like respiratory standpoints and everything, but we're not going anywhere. And I drive by people and I see people smoking and I'm just like, you're my security, but you're my job security. So, that's me being funny, but
oh my gosh.
I think it's a really good field. I'm very glad I did it. I'm going to be a lifer. I'm not going anywhere. I plan to do hospital care for a long time. I couldn't imagine sitting at a desk or just doing education or anything like that. Like I need this. It's fulfilling.
I cannot thank you enough for being the first person on this podcast, and just sincerely thank you from the bottom of my heart for all the hard work you're doing during this COVID and during the pandemic and through everything, because, from an ICU nurse to an RT, you guys are just so important to the entire team. And I really hope that this episode lets all the respiratory therapists out there know how important you are and how much we all appreciate you. Thanks so much for listening. I am so excited to finally share this incredible platform for female healthcare professionals with phenomenal women just like yourself. And until next time, guys, cheers, everyone.
Thanks again for tuning in to the Bedside Manor podcast. Before you head out, don't forget to subscribe to get instant access to all upcoming and future episodes. Connect with Dani and her team on social media at Bedside Manor Podcast and at DanielleElizabeth_RN, or our website at www.danielleelizabethblog.com.